Hey everyone, I hope you're doing well. Shannon Mick here, National Certified Counselor, Licensed Professional Counselor, and I specialize in helping people manage anxiety. I want to talk about something real quick since I am on a treadmill and I'm not going anywhere anytime soon. So something I kind of thought about yesterday. I decided to share it with you. I think this is something really common, and I think the trend is kind of, as far as mental health goes, moving away from this, which is good. That's the correct direction, and that's going to our general care providers, our doctors, and seeing them for a mental health concern. Whether that's you want to get on, say, anxiety or depression medication, or whatever it may be. And I think it's common for us to kind of just think, oh, well, something's going on. Who do I go see? And that might be the person that comes to mind. Here's, an example. I'll share with you a little personal story. I did that back when I was in my early 20s. I was experiencing anxiety, and I went to my doctor, and they were like, yep, that sounds like anxiety. So I got prescribed a medication. Now what happened was I took the medication as prescribed. I did it for about a month, okay? And around that time, things kind of should start to, you get an idea if it's working or not. And for me, it was definitely not working. I was feeling way worse, in fact, experiencing signs of depression on top of my anxiety. And I realized the medication wasn't for me. So I didn't have any knowledge. I was not provided anything about this medication I was taking, nor its side effects, or, the possibility that I could experience depression. So, if I didn't know, and of course I stopped taking the medication, and I never went back to my doctor for it as well. So I think it's common for us to kind of just think, I'll turn to my doctor, and they're going to help me out. But so the problem with that is, one, our doctors only have about 9 to 11 minutes to meet with us, which is not enough time to diagnose or treat anything that's mentally going on, such as, say, anxiety or depression. Second, they don't have the resources to be able to do that. Their education is not based off of mental health, okay? They would need, in order to be able to, do like the things that a psychiatrist does, they would need another 5 or 6 years of schooling on top of what they've already done. So as you can see, there's a few problems with going to your general care doctor. And like I said, I think we're moving away from this for mental health and reaching more out to professionals and the right type of people that we should, and finding a counselor, therapist, anybody, mental health professional who's a good fit to work with us, so that we get someone who's knowledgeable and knows how to help us with exactly what it is we're going through. So I think we're definitely moving in a good direction with that, but that's just something I wanted to bring up. And if you know somebody who is going to a primary care doctor for their mental health, please steer them in the direction of meeting with a professional counselor or, other mental health care provider. All right, guys, I'll see ya.